The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting group. Access Fort Wayne is a department of the Allen County Public Library. If you or anyone you know might be interested in making a television show, please call 260-421-1250.
Hi, Dr. Rudy Cashman. Welcome to the show. You may find this quite interesting. Today we'll be speaking about headaches, stress headaches, migraine headaches, a very common problem. And I'll try to explain it to you, how to prevent them, how to stop them, how to reverse them. So let's get on the road, okay? And the best description I would say about migraine headaches is the best prescription is knowledge. You got to know something about it. You got to watch some of the YouTube shows I have, maybe attend a lecture, maybe read some books, because it's not that simple. But most of them can be very well controlled and prevented, but knowledge is your basis, okay? So 50 to 90% of headaches are migraines. Migraines are something different, and I'll explain this to you. It's not just a little pressure or a little headache. I mean, they are really in attack, okay? About 37 million people, Americans, have headaches, yeah. Actually, 3 times more common in women than men, perhaps because they lead more stressful lives. You know, they get the kids, and then you get the big kid who comes home at night. This is important to know the difference. And regular headaches are a little less than migraines. Migraines, you may need to curl up and go to bed and miss work. So migraine is a complex neurological disease that affects your central nervous system. There are actually changes that are occurring there. And they're misdiagnosed many times. People think, well, they got a headache, when it's a very specific thing which reacts to a very specific medication. So most migraines, people have a warning. About 30 to 60% have a warning beforehand called a prodrome. About 30 to 60%. And I explain to you in a minute what that is. Some have an aura, they see something, okay? About 20 to 40%. Scribbly lines is more common. Some even, it's almost like a mosaic, like a painting. And then they have the headache, okay? And then the majority have the postdrome, some symptoms after they're done with the headache. Generally, the prodrome, okay, the thing that occurs before, about 1 to 48 hours before a headache begins. And what can they be? Food cravings. You just want to eat everything. You get very hungry. You're really craving food when you normally don't. Increased appetite. You just want to eat anything you get your hands on. Some have diarrhea, just unannounced diarrhea. Some have constipation for a few days beforehand. Mood changes, depression, irritability, euphoria, talking real fast, for example, can be part of a prodrome. Other things, muscle stiffness, all of a sudden you feel tight all over. Increased frequency of urination. Yawning is a common one. You're yawning all day and you've had a good night's rest and you wonder why. Difficulty concentrating, so it affects the mind. Sometimes difficulty speaking dysarthria, aphasia, can't get the words out. Dysarthria means you can't get the muscles going. That can be prodrome. The aura phase is where you scribbly lines are the biggest thing. Sometimes flashing lights. I've never had a headache, but I think I do have some of these squiggly lines sometimes, a reaction to bright light. You kind of wonder if that isn't a migraine prodrome. Some have olfactory or another, this funny smells or funny noises. Any of the cranial nerves involved. Funny feelings, funny taste, funny aromas, things you might hear that are unusual. So it can be phonophobia, okay? Photo, visual things. Almost, they'll say migraine art. Yeah, it's like you see distorted flowers or paintings. And they've even had some exhibitions with migraine art, yeah. And osmophobia, smelling funny things. Some speech problems, can't get the word out. Migraine art, it is, you see it in Oliver Sacks's books. Very unusual, very unusual configuration. It's almost beautiful, all created by the neurotransmitters of your brain, yeah. So what types of migraines do we have? Many different types. We migraines with aura, we spoke about that, okay? Where you will have funny feelings or tastes, or classic and common migraine. Basilar type involves the cranial nerves at the base of the skull, which would involve tingling in the face, funny taste, for example. The basilar type. Menopausal menstrual migraine, yeah. Some have them only at the time of menstruation. Starts about 2 or 3 days before. They'll have an aura, and then the menstruation starts, bang, they have the headache. Interesting enough, I was at Starbucks one year studying about migraine headaches, and one of the people who works there said, I have migraines, and she would ask me some questions. I said, just fine. And I quizzed a little bit, and she had an aura about 2 days before a menstruation. It happened every time. Only time she had a migraine, and I told her to take a triptan. There are about 7 drugs that help treat it and help prevent it, and triptans, and she took them, never had a headache again. Isn't it interesting? Yeah. And it was a plague to her. Some they occur only at menopause when there are hormonal changes, okay? Sometimes it runs in families. It's called familial hemiplegia, where a lot of people in the family literally have the headache and become paralyzed for a day or two. Yeah, as a neurosurgeon for 45 years, I saw some of those. And familial hemiplegia, and you thought they had a stroke, when in reality it was a migraine headache. Always cleared up. Retinal migraine, where people may go blind partially, sometimes totally. It has been reported even some that are totally blind for a day or two, and then it clears up. Wouldn't that be frightening? Or just most of the time it's just one eye, okay? And then there are people who have chronic or status migraine, where they have it almost every day. That's unusual, but indeed it does occur, okay? And what's the character of all migraines? All type migraines we spoke about: throbbing, pulsating, pounding 85%. Some it's like a knife or a hammer or an ice pick. Mm-hmm. Can you imagine that? That's why it's so important what I teach today about prevention, that you gain knowledge. That's the best prescription, knowledge, okay? The migraines usually last 4 to 72 hours, thank God, okay? Usually are one-sided, 20% occur on both sides. Sometimes be one side, one ear, other side the next, and some of about 10-20% are back of the head, okay? They commonly start during sleep, and they'll wake up with that pounding headache would be quite classic. Other characteristics of all migraines: nausea, vomiting, 80%. 33% vomit, photophobia, that the light bothers you, phono, that noises bother you, phonophobia, and you smell funny things, osmophobia, that's common to almost all of them. Ringing in the ears is quite common. Pain is worse with exertion or exercise, would be characteristic of a migraine. Loss of appetite, you just don't want to eat for a few days, it occurs. Fluids running from your nose, rhinorrhea, and increased lacrimation where tears drop from your eyes are very common with migraine. Now, post-drome, after the migraine, you feel like a zombie or a hangover. You just want to go to bed for a day or two. You can be very sleepy. Occasional person is very euphoric. Just can't seem to stop talking and feel like I'm in heaven, okay? So let's go through a little more. Usually one-sided, 80%, okay? And most are moderate to severe. But a lot of the people will say childbirth doesn't even come close to explaining the pain. Wow. Most of them are pulsating, not steady. If it's a continuous headache, more commonly it's stress. Pulsating is characteristic of migraines. Physical activity tends to aggravate it, although occasional patient will say it's a stress reliever, so it may help prevent it, okay? Nausea, vomiting, diarrhea are common to all of them. Vertigo, dizziness, dime a dozen in especially migraine headaches. And during the headache phase itself, generally loss of appetite, food cravings go away, runny nose, runny eyes, hot flashes, chills, dehydration or fluid retention are common, inability to concentrate, confused, memories poor, an array of emotions, fear, depression, anxiety, irritability, even total panic, not uncommon with migraine headaches. There's an identity that's very interesting called migraine equivalent, where you have no headache, but for example, you might have belly pain. Very tough to diagnose unless you have migraines already. They occur more commonly in children. I actually had a relative with it who was operated on the belly 4 times, and they made up a diagnosis for her every time. And it was never diagnosed. I can understand that because I saw her in her 20s. She had classic migraine at that point. So when I look back to all those years where they operated on her, really never found anything, just made something up. I bet you she had migraine equivalent. Very interesting. And visual loss, half the vision, quarter of the vision, mosaic art, total blindness do occur occasionally with migraines. Okay? So what is the migraine brain? What is the migraine brain? Hypersensitive brain cells. Yeah, they've proven it now. The brain cells will react to any stimuli it finds displeasing. Yeah. It's a neurologic disease. It's not just stress or something. It really, in essence, is a seizure from the brainstem. That's the base of the brain, and that's normally where the migraines begin. It's actually based on your neurotransmitters, your dopamine and your serotonin. There's real science behind this, okay? Real science behind migraine. There's an entity called cluster headaches, which are the worst. They may be there for a month and then they're gone for 10 years and then they come back. 10 to 1 men. Remember, regular migraines, more women. But cluster headache, 10 to 1 men. Kind of a migraine. Breathing oxygen helps at the beginning. Sumatriptan, which is a triptan. Nasal spray seems to help. They're called suicide headaches. That's how bad they are. Suicide headaches. They're like an ice pick in the eye. That's an easy way to remember the cluster headache. Like an ice pick in the eye. Can you imagine what it must feel like? Can you just imagine, you know? What they've shown the science of migraine now is called cortical, that's the surface of the brain, cortex, spreading depression. That's the new science. where they have demonstrated with functional MRIs that they see these waves going across the brain, and they analyze them, and it's serotonin, an actual neurotransmitter. You have the axon, and you have the dendrites, and across the synapse jump neurotransmitters. And this one, it is mainly serotonin. So that across the brain, they see this wave of serotonin, which heads to the brainstem, which then heads out the blood vessels, nerves, to the surface of the scalp. That's the reason patients with migraines have enlarged, dilated blood vessels. You can see them. And if there's a one-sided headache, you might see them only on one side. They're dilated, they become inflamed, they become red, very sensitive to touch. That's a classic migraine. So the old theory was the blood vessels become enlarged, dilated. They indeed do become dilated, but that's not the cause of the migraine. It's the neurotransmitters that are inflaming the blood vessel in the nerves. That is the cause of the migraine. So it's about neurotransmitters. Remember, we spoke about that. Serotonin, and dopamine is involved too. Dopamine is the quick fix. Serotonin is the long-term fix. Nature designed a circuitry for relaxation, depression, and pain receptors. So it's an inflammatory response of the vessels that cause the pain. And the scalp, you see them enlarged, become red, inflamed. That's really the result of these neurotransmitters. Yeah. So, but the brain becomes hyper-excitable during a headache. So in our brain, believe it or not, we have the migraine control center. There is an area size of a, say, quarter in the area of the hypothalamus at the base of your brain, where there are a lot of control centers. And generally we have a blood-brain barrier which protects us from a lot of medications coming in, chemicals affecting our brain. But this small area in the hypothalamus has no blood-brain barrier, so external stimuli can come in through this little hole to cause the migraine. Stress, hormonal changes, dietary triggers, bright lights, strong odors, sleep disturbance, all kind of lead to this little area, to the migraine control center, okay? And so the hypothalamus receives a constant flow of potential triggers for migraine. In the end, you'll hear me discuss about a migraine threshold, that we have a threshold here so that many times it's not just one thing, like a cigarette smoke or alcohol or a piece of cheese that triggers the migraine. What I'm thinking is, it's when you break the threshold. It may be the 3, 4, 5 things you did in the last few days, and then the final thing you take is say, it's that cigarette that the guy's smoking that caused my migraine, when in reality, I think it may be a buildup of many other things. Very interesting, isn't it? And so there are other types of headaches, ice cream headaches. I've had them. They seem to have gotten worse at my tender age, 39 here. You believe that? Okay, I had a bridge to sell you. And I get those, and I think it's vasospasm of the blood vessels in the head from having ice cream, the cold. Caffeine withdrawal, coffee withdrawal sometimes will cause a headache. God, you would think I'd have it, because I do drink 2 or 3 cups of coffee a day. Keep the doctor away. No, generally that's considered good. Orgasm headaches, they can be, you can have it every time. It can be very severe, so severe you think you busted a blood vessel in your brain. So to take a preventative medication maybe an hour or 2 before, maybe not a bad idea. The darn trouble is you might confuse it with a ruptured blood vessel in your head. I mean, if you have them all the time, you wouldn't think that'd be the cause, the headaches. So if you never have headaches and you have an orgasm and you have a horrible headache, you got to worry about ruptured aneurysm. And you need to go to the emergency room. I've seen it as a neurosurgeon, more than once. But again, a migraine can do that, but if your life is at stake, maybe the ER is the place. And rebound headaches. What are rebound headaches? Rebound headaches are headaches you see in people who take a lot of medication. If you got headaches on a regular basis and you are taking, say, 5, 10 different medications, you will never, in my experience and books I'm reading, be cured of your headache till you get rid of all the medications, give yourself a few weeks, and then you take no more than 2 triptans a month, the 7 we'll speak about later, or NSAIDs or Advil or Tylenol or something, no more than 2 a week. You do more than that on a regular basis, I don't care how many headaches you got, they'll only get worse. I know somebody that way, and they never did change, and their life is spent on headaches. They refused to stop them. And when I told them, you got a rebound problem, okay? Fibromyalgia, you hear that term a lot. People come in with neck pain, headaches. To me, after reading about all this, I wonder if fibromyalgia, at least in the neck and shoulder area, isn't a mild migraine. I wonder about it, I wonder about it. And sinus headaches, actually I misdiagnosed the majority of the time. 90% actually are migraines, yeah. They want to operate your sinuses because of CT, now the sinuses, and they're so specific, so detailed. They can always find a little something. Oh, we need to operate on this little thing to relieve your headache. When in reality, you're having a migraine. Watch out, watch out. They're doing a nocebo on you, negative speak, where they can take an x-ray, a blood test, and convince you this is the cause of your problem, you need an operation. Watch out. So it's uncommon to have headaches with sinusitis or sinus trouble. You can have pus in your sinuses. Most people don't have a headache. So it's hard for you to understand. That's the reason how important I think this is to you. And stress headaches, tension headaches usually feels like a tight band. It's pain throughout the head, dull and steady, not throbbing, okay? They can occur without warning too. They can be mild to severe, but not like a migraine, most of them, okay? No nausea, vomiting, or visual symptoms. They can be triggered by stress, bad posture, fatigue. Increased sensitivity to light or noise can occur, but not both. So occasionally it's confusing, and I think a lot of people think they get stress headaches when they get migraines. And since there's specific migraine treatments, it's important that you know which type that you have. Okay, so there's an emotional cost to migraines. So put migraine health first. You have migraines, they need to be an important part of your life. You need to learn a lot about them. You need to know the family know. Your employer needs to know. Your babysitter needs to know. And you have to be ready for them, okay? So plan ahead. Have your emergency room prescription available, okay? So that you can quickly go to your doctor or pharmacy and get medication. You should have bought the medication ahead of time. Is really the main thing. There are emergency migraine drugs. When it's just out of hand, you're vomiting your guts out, go to the emergency room, especially if you're not sure it's a ruptured blood vessel or something, and they can give you an emergency migraine drug, okay, which can be Ketorol, something for vomiting, okay, something for relaxation. Very important. Most emergency rooms have this, and they give you a highly inflammatory pain medication like Ketorol, and morphine in these drugs will not do it. You need an anti-inflammatory because this is a headache of inflammation, okay? So have preventative, abortive, and rescue drugs ready to go, and I'll tell you about them in a minute. 41% of the people have difficulties with the family of their employer because you didn't tell them about them, and when you get them, you can't continue to work. You got to be able to send you home right away, not penalize you for it. Your fellow workers need to know about it so they don't do things that cause you migraines, like smoke in front of you, drink a lot of alcohol in front of you, for example. So 23% have serious interpersonal relationship problems with spouses and friends. Yeah, your husband needs to know about them, or girlfriend, whatever. So what are some dietary triggers? Let's go through them a little bit here. Some aged foods, canned, cured, mainly smoked meats, bacon, bologna, chicken livers, canned ham, corned beef, fermented sausages, pickled herring, dried hot dogs, pate, pastrami, pepperoni, salami, sausage, spiced meats, aged cheeses, buttermilk, ice cream, sour cream, freshly baked yeast bread, sourdough, bread beans, fava beans, lentils, lima beans, navy beans. You're starting to get the idea? So if you have migraines, you probably need to read a book or two, and I'll give you the names shortly. You need to gain some information, things to avoid if you get a serious problem. Other ones I'll go through quickly a little bit here. Peas, sauerkraut, avocado, citrus fruits, olives, pickles, salad dressing, soy sauce, artificial sweetness, MSG, seasoning, spices, vinegar, alcoholic beverages, caffeinated drinks. Good thing I don't have migraines. Cake, candy, chocolate. A lot of things I mentioned have sugar in them. I'm sort of convinced when we speak about this migraine threshold that changes of sugar level can trigger a migraine. I know my piano teacher, for example, when I advised her to eat different food for her migraines, they totally went away when she is careful with sugar. And when she ever gets overcome by a donut or whatever, from the stress of life, for example, she eats it, bango, migraine. She's told me many times I was absolutely right. So I wonder if almost 80-90% of migraines are due to changes in your sugar level. Yeah, so sugar is the booger and the hooker. Okay. And cupcakes, aspartame, beef concentrates, cheese, Chinese food, that's a big one. Food dyes, meat tenderizers, nuts, peanut butter. And so the list is long, okay? So eliminate all trigger foods. Drink lots of water. That's helpful. Stick with nothing but bland food for 2 or 3 weeks. If you have a number of attacks, see if it makes a difference, okay? And then reintroduce food, spot the troublemakers, okay? And so ban and remove triggers from your diet, okay? The most common triggers are smoke, especially cigarettes. Yeah, bright lights. Remember I told you that I wonder if I don't have a beginning of a migraine on occasion. Flickering lights seem to do it to me. Dehydration, so keep up with the fluids. Weather changes. Some people can tell a migraine's coming because of the number of clouds in the sky. Dust can bring it on. Remember I said sex can bring it on. A light blow to the head can do it. Dental problems, jaw malfunctions can do it. So stress and tension is a common trigger. Certain foods, sleep issues, lack of sleep leads to migraines. Alcohol, especially red wine. Hormonal changes, remember we spoke about menstruation. Certain exercises will do it. Strong smells, perfume, fresheners, even flowers can set off migraine. Cleaning fluids, chemicals, formaldehyde are known triggers. So Rudy's top 10 migraine preventers, let's go through those a little bit. Exercise, half hour daily. Proper sleep, 8 hours a day. Who can do that? As a neurosurgeon, I did 4 hours, but I'm doing better now, 6 or 7. 6 to 8 glasses of water. Proper eating. Learn about your triggers. You're going to have to get a book and read about them a bit. If you want a copy of my PowerPoint, go to Three Rivers Pharmacy. Ask Sheila in Fort Wayne, Indiana. You want a copy of my PowerPoint on migraines, she'll print it out for you. Okay. Stress reduction. I've written the 20 prescriptions for stress reduction. That's helpful. Again, Sheila Arnold at the pharmacy at Three Rivers, she can get them for you. You want to call ahead, you're coming, 373-1083. This is important, so that's what they're there for. So strong relationships, love of the family, emergency friends are helpful. If you get a big migraine problem and you get 2 kids, you may need an emergency babysitter, so you need to have those things lined up. Music at home and in the car, not too loud, seems to reorganize your brain, can be helpful. Blasting away is not helpful. Then we have preventative medications, which can be relaxers, for example, antidepressants can be helpful. Physician relationship to the patient is critical, that you have a physician who's willing to listen. Avoid the triggers. Promote good health habits. Design your diet, how you're going to eat. Read my book, Secret the Non-Diet, about eating nutrient-dense food. You get less migraines, okay? And sometimes stress is so severe that it turns into a psychiatric problem. But that doctor, if you get regular headaches all the time, you got to have a doctor who's listening. If he just hands you a script and doesn't listen, get somebody else, okay? There are some people who have headaches all the time. It's a way of life. They don't want to get well. They don't stop the medication to get rid of rebound. It's a way of life, okay? Some people, it's the way it is. So for some, new choices need to be prevented. Avoid victimization dependency. You may start as a quick fix without a plan. A quick fix would be to go to the emergency room, get a narcotic medication, and you got no plan. You're going to get more migraines, okay? So you may start as a quick fix and they hand you narcs. You may end up with addiction and rebound headaches too. Mm-hmm. And so headaches become worse because of rebound, taking too much medicine, okay? So a quick fix may keep you from doing prevention. Mm-hmm. Prevention will not work when having rebound headaches. You keep them coming, you intend different medicines, you'll never get over it, okay? So going the route to preventative treatment, 90% of the time is avoidable, okay? And occasional painkillers, fine. Too frequent, worst headaches, rebound. Make a plan. Try preventative medication first if you need to take some medication, antidepressants, for example. So avoiding rebound, too many medicines, can be a very serious problem. Some say only 2 days a month for using a triptan, these 7 drugs that we spoke about. Only 2 days a week for non-triptans, Advil, Tylenol. Others are a little more liberal, okay? If they give up on you and say, I can't help a headache, should never get better, rebound actually may be the problem. And it can be complex because the person I can think of goes to a neurologist, the best one probably this part of the United States on a regular basis, but he doesn't stop at medicine. He needs to read these books, or maybe there are other reasons, I don't know. You know, so it's a fine line there. There's a fine line there. And rescue drugs, okay, when things are out of hand, Toradol, remember I spoke about the anti-inflammatory, ketorolac, Toradol, same drug, is anti-inflammatory and not narcotic, okay? I used it once for kidney stone. Man, it worked. Magic. It's not used enough. We need to use them more often. You can't use them more in a week, but that ketorolac is highly inflammatory. I had a kidney stone. It had me dancing down the hall in about 2 minutes. The emergency room doctor hadn't used it much before. So I told him about it, and it sure worked. And Tylenol, aspirin, ibuprofen can be a rescue drug, no more than 2 a week, okay? What are side effects of triptans, the 7 we spoke about? Sumatrex would be one. You can't be taking any SSRIs with triptans. You get a serotonin reaction. I imagine that could be serious. You cannot use it with hypertension and vascular disease. That limits things a little bit, okay? Before triptans, we used Fiorinol. ergots, for example, barbiturates, coffee. A lot of those we've given up on. So what are some of the other abortive medications, okay, which we spoke about, the triptans? Relpax, Frova, Emerge, Maxalt, Imitrex, Zomic. One of the big tennis players, one of the Williams sisters, had a headache playing tennis, big tournaments sometimes. Yeah, once she had to stop a match. And then someone diagnosed her as menstrual migraine. Yeah, simple as that, menstrual migraine. And she taking abortive medication, no headaches, playing tennis again. Interesting story. And there are many stories like that, okay? And there's some other ones which are not used much. One is Gelstat, 50% effective, yeah. You put it under your tongue. Only a few pharmacies carry it. Other ones are sublingual and can be cheaper. Triptans, best when they're taken as soon as the headache starts or during the aura. That's the best time to take them. So to take them as a preventative is not as good as an abortive. Okay? They're best for abortive medications. And they don't work well when the headache is in full swing. So get it in the aura or at the very beginning. It's a serotonin agonist. That means it keeps serotonin in the blood system. It won't let the body detoxify it right away, so it lasts longer, okay? They bind to serotonin and noradrenaline receptors. And also activate serotonin receptors in the trigeminal nerve and reduce inflammation in these arteries out here. And reduces substance P that is produced by the inflamed arteries and nerves while you're having a migraine. So take these drugs before it gets going. Let me give you some good websites here. www.migraine.org, www.helpforheadaches.com, www.headaches.com, some websites. And you get a copy of this PowerPoint at the Three Rivers Pharmacy in town. Preventative medications include beta blockers, SSRI inhibitors, seizure medications, ergot derivative, Sansert. These are preventatives, okay, preventatives. Cluster headaches, remember, we spoke about earlier as being very severe. Let me tell you about them a little bit more. The eye is swollen and red. The pupil may dilate, usually short, about 30 minutes, like a barbecue skewer in the eye. This is right out of Oliver Sacks's book. Good God, like a barbecue skewer in the eye, and it's red and swollen. It disappears and reappears. Rhinorrhea, swollen eyelids. Triptans do little. Most painful of all headaches. Mm-hmm. This might be one you need to head to the emergency room, huh? And headaches description, Oliver Sacks, who unfortunately died a couple of years ago, a great neurologist from New York. His soul was really involved. To read his stuff, Musicophilia by Oliver Sacks is a good one, music and healing. And and what he mentions is only a small number are using the correct medication. Mm-hmm. That's the reason reading, participating, I think, are important. Many are misdiagnosed. We said some that already. The provider must be a careful listener. He must be a partner in your health care. No two patients are alike. That's my experience too. 50% required treatment, 50% prevention works. So 3 main keys he mentioned. Avoid rebound, know your triggers, reduce your threshold. You know enough now to what I'm talking about, okay? So with migraine headaches, people can have increased depression, and 90% can be prevented. Mm-hmm. 90% of this horrible problem can be prevented, but you must participate. You must do what I'm telling you, okay? And If you need to know more about it, come look me up at the Three Rivers Pharmacy. I'll see you for free. So Oliver Sacks describes headache as hammering, throbbing, pushing, pressing, boring, bursting, pricking, stretching, piercing, like a skewer or an ice pick, brain torn apart and pushed out of your ears. That's Oliver Sacks describing him. I'd say he's a very empathetic doctor, just a plain great doctor, that guy. And he also mentioned that prevention is the key. Prevention is the key. When to call the doctor, a change in pattern, okay? And 95% of the headaches we get are harmless. Worst headache you ever had? Go to the emergency room. Go to the emergency room, yeah. And that can be a sudden headache and vomiting and neck pain, and from anything to unconsciousness can be emergency room. Now, call 911 if you fainted during the headache. More likely to be a ruptured aneurysm, okay? Headache and stiff neck could be. Suppose you had a headache yesterday and you decided not to go to the emergency room. Maybe it wasn't so bad. But the next day you get a very rigid neck, go to the emergency room, even if you have no headache, because that could be the blood irritating the meninges, and you get a stiff neck because of it. And so a headache and stiff neck could be ruptured aneurysm. Headache and a temperature could be meningitis. I've seen that too. Totally missed. So trigger levels and threshold, I think, are pretty important things to understand. They're different from person to person, okay? Increase your threshold by relaxation techniques, yoga, tai chi, swimming, bike riding, tennis, pickleball, whatever, to relax you, can increase your threshold. That's likely to get a migraine. But remember, sometimes exercise aggravates the migraine. So many times, in my estimation, it's a number of triggers that you have, things that add up over the last few days, and then you get above the threshold. And generally, you give credit to the last thing that occurred. You say, it's the glass of wine that triggered, but it may have been 3 or 5 triggers before stress, for example, loss of sleep, for example. So it can be, think about it yourself and see what you're noticing, okay? Maybe a bad day at work and then you get a headache the next day, added by a glass of wine, added by a cigarette, maybe an argument within the family. So it's the added things that may lead to it. Remember what I said too. To me, change the blood sugar level, I think, can do it. So the greater the trigger load, the worse the headache. The worse your stress, for example, the worse the headache. And when to call the doctor, we spoke about before a little bit. Loss of speech could be a brain hemorrhage. Head injury could be a blood clot. A seizure could be hemorrhage or a tumor. A progressive headaches over a year probably is a tumor. I've saw it many years. So anyone with progressive headaches should have a CT or MRI sometime. Many tumors get discovered that way. Now educate yourself, okay? Educate your family. They'll be more understanding if you tell them that I can't help, I get these, and work with them on the triggers for them to perhaps stress you less. Maybe food being cooked for you could be a little less sugar, for example. So educate your children about it. Migraines can be inherited. They're more common in the same family, maybe because of the same stress, but maybe it's actually partially genetic. So you must educate your spouse about migraines. It's a no kidding around problem. You got to tell them, and that you have, once it occurs, very little control of it. They must help you to get into the right situation, get the right medication, and occasionally maybe take you to the emergency room. Your employer must say, hey, lay down, or say, call somebody at home to pick you up and take you home. That may be necessary, okay? And on my last page of this PowerPoint, then I review things with you. If you suffer from migraine headaches and regular headaches, would like a second opinion on alternatives to treat this illness, you can set an appointment to see me, no charge. Call 260-373-1083, Foley, Indiana, and at the Three Rivers Pharmacy, where Sheila Walker is in charge. I will see you for free and follow you for a long time to try to get this out of your life. Migraines are a disease and should not be treated lightly. I see many people know very little about it. The best prescription is knowledge. You should maybe define this show for you later on YouTube. Watch it 2 or 3 times and maybe get a book. Let me review a couple of books with you a little bit. Heal Your Headache, the 1-2-3 program by David Buchholz. It's a very good book to read. And it speaks about the 1-2-3 program in there, which involves preventatives and to avoid a rebound, for example. He also lists a lot of the foods to avoid. And remember, some children get migraines too. Yeah, little kids can have migraines. Mm-hmm. So maybe they can teach you about the internet. Well, they give you, and because a parent and the child need some equal language here, okay? And one migraine may be totally different than the next. What triggers may be totally different. The migraine art that you may be seeing in your auras, things that you see, could be totally different from headache to headache. Mm-hmm. One may look like a painting, and the next one may look at squiggly lines, for example. Also, the noises that you hear may be different from one thing to another, especially if there may be imaginary noises nobody else is hearing except you are. Watch out. That could be a migraine, aura. So this is physically based. It's not something that is something that you imagine. And it relates back to Candace Pert, P-E-R-T, who wrote a book called Molecules of Emotion in 1971. Rarely do I speak to anyone who's ever read that book. She discovered that we have receptors in our cells. So our thought process, our dopamine, our serotonin, other chemicals in the body, they hit those receptors and send the message to the cell. So this is why emotions with dopamine, serotonin, epinephrine, norepinephrine can have such great effect on us. So it's important that some people take it preventative, that nutrition is very important. Stress of life is extremely important. And I think I tend to keep a journal, write things down, what triggered my headache, keep a list of stresses that may have occurred. You know, maybe something in the household that, for example, in my home, there's a rule from 7 p.m. to 7 a.m. We don't discuss problems in our lives. Everybody has problems. I mean, life is like the stock market, except some days it really dives. And that's life. You must understand that and learn to react to it. You know, unless there's an emergency, I don't allow problems to be discussed between 7 p.m. and 7 a.m. I always say, those problems belong to God between 7 p.m. and 7 a.m., no matter what you believe. But of great value is you sleep better, because if you're discussing stresses before you go to bed or thinking about them, the thought process is even more important. To wake up at 3 a.m. with a full-blown migraine, would I be surprised? No, I would not be surprised. And people commonly do. Migraines commonly do start during the night. You may think you are sleeping, but that brain is not sleeping. It's reorganizing and cleansing itself while you think you are asleep. So I think that's a good one for you. Common dietary triggers, the more common ones are coffee. I must not have migraines because I drink a couple of cups of coffee. Actually, it's saying now it's healthy. I hope so. Chocolate. Mm-hmm. Can do it. Tea, iced tea, cola, and MSG, which are more commonly in foods in a Chinese restaurant. Soups, bouillons, salt, salty snacks, they can do it. Processed meats and fish, more likely to do it. Cheese and other dairy products are common dietary triggers. Mm-hmm. Nuts, except the seeds are okay, and can do it. And pretty darn, I like to eat nuts. Alcohol and vinegar, especially red wine, can do it. Vodka is best tolerated. I don't drink that, okay? Certain fruits and juices, okay? Certain vegetables, especially onions, sauerkraut. But, check them one at a time. You wouldn't have to eliminate everything in your life, okay? And baked goods do it. Aspartame, saccharin can do it. And it can be difficult to tell. And I specifically state that the impact of the food you're taking has on your sugar level may make a huge difference. So keep an open mind about that. Remember, my piano teacher thought it was the change of a sugar level that seemed to trigger the migraine. Yeah, anything sweet seemed to trigger it. And so to determine what's a trigger can be quite difficult. Another book that I like is Carolyn Bernstein wrote this book, The Migraine Brain. The Migraine Brain. Also a very good book. It's helped many patients. And she has in there preventive programs, triggers. She discusses and understanding your unique brain. Some people have a migraine brain. They're more likely to get triggered. Could be because you're female. Could be because partly genetics. Partly because more reactive to stress. For example, and she speaks also about using anti-inflammatories instead of, say, narcotic medications, okay? And she also has a chapter in here about planning for pregnancy, and so you have to be concerned about that. Although during pregnancy, when the hormone levels are changed, most of pregnancy can be migraine-free because of hormonal changes. But then, they may come back, and but you got to avoid medications during pregnancy. So you need to speak to your doctor. If it's just totally out of hand, you can't stand it. You talk to your doctor about that. I don't want to recommend any one specific medication in them, but they're dangerous to your baby. So you got to get off the medications. And this, I think, is very important. So pregnancy, and if you're breastfeeding, you got to know about all these things. And the best way to do that is to deal with your doctor and to maybe read Carol Bernstein's book a little bit, so you don't have a medication aboard that might affect the baby. Like if a person smokes, for example, the nicotine will make its way through the placenta to the baby, and your child will be born addicted to nicotine. Mm-hmm. And if the medication you take for migraines doesn't harm or kill the baby, but maybe it can affect it. Increased rates of cancer, for example, or stress or weight control, all can be affected by what you're doing. So as a migrainer planning to become pregnant, you want to use time to really get healthy. Don't smoke, don't drink, exercise at least 5 times a week for at least a half an hour. Start to wean yourself off caffeine, okay? But don't go cold turkey with cigarettes because it can trigger migraine. Ask your headache specialist or primary care doctor for a year's worth of prenatal vitamins before you start trying to get pregnant, because you want to start to build up your supply of folic acids, which is essential for fetal nervous system development. Interesting, yeah. So she has a great book, and to read, because pregnancy is a different situations, because you're not just eating for one, you're eating for two, okay? She also mentions that over-the-counter medications have side effects too, so you got to know those, okay? So let's summarize the situation a little bit about migraine. Headaches is the most common sort of a headache. I think a lot of people think they have sinus headaches. They're actually migraines. That we know about menstrual headaches occurring because of hormonal changes in your body. That some people have migraine brain that's a lot more sensitive to migraine, and that it's a real thing. It's related to dopamine, serotonin secretions in your brain that affect your actual cells. So it's a real thing, and you got to let your boss know that you have this. You have to let the family know you have this. Not that they won't notice, but that they may think you're an odd person or you're a stressed person, when in reality, this is a disease like anything else, but it's largely preventable, stoppable, reversible 90% of the time. But you must have an emergency kit available of drugs you may need to take, of smoke, alcohol you may need to avoid. So you need to let your employer and fellow employees know as to what your problem is. So information is very important. So I hope I get you to read some books, get a hold of my PowerPoint, and I have some YouTube lectures already available on migraine headaches. So the great news is 95% of the time you can prevent it, stop it, and maybe even almost essentially cure it. But if you're not going to participate, you're not going to read, you're not going to look at something and learn about the medications that are available, this could be a lifetime plague. Migraines could be your life. Mm-hmm. It can be your life. But the good news is that if you participate, 95% chance that today we did you a lot of good. We did you a lot of good. It's not something that you got to have and guaranteed to have. You indeed can do something about it. You have to watch today's medical care, because a lot of times you go to a provider and they're not interested in talking. You may need to get another doctor, because most of the time it'll be, boom, here's your script. I don't want that. I want a discussion. I want both of to get to know each other. And I did this today because I care about you. I love you. And thanks so much for listening. Hope to see you at one of my talks, or maybe at the pharmacy. Let's travel this road together, and we'll be smiling and tap dancing and having a good time. Bye-bye.